Today I have the pleasure of speaking with Chris Moreau. How are you today, Chris?
I'm good, Tracy. How are you?
Chris, I'm very excited to speak with you because, first of all, I love the stock. This is MOM, M-O-M, on the TSX Venture Exchange. And of course, your most recent news release is about your accomplishments for 2014. Why don't we start there?
Okay, let's. Our first major accomplishment for 2014 was the signing of a up to 90 million deal value with a Chinese pharmaceutical company. This is a company that reached out to Miraculins when we acquired the Scout technology. They have distribution of pharmaceutical and small medical devices in the Chinese hospital market. They contacted us when we acquired the Scout. They said they had been following the technology for some time and they wanted the rights to China. And after a number of trips to the Chinese market and working out the best possible distribution deal, we announced a deal in August. That deal includes milestone upfront payments, a $15 million guaranteed order when we achieve Chinese FDA clearance, which we are anticipating to happen in the next 12 to 16 months, and an additional 15 to 20 million per year to maintain their exclusivity in years 2, 3, 4, and 5. So it's a major deal for Miraculins. It's the first time we can actually point to a potential revenue stream that is contractually is part of a contractual agreement.
So for everyone out there, we have a junior with cash, and you heard that correct, a $90 million deal from last year. So let me back you up. Can you tell us who is Miraculins, and tell us just a little bit about yourself?
Miraculins is a Canadian-based medical device company, and our focus is non-invasive diagnostic tests and screening tests. And we have two lead technologies. One is a technology for cholesterol, tissue cholesterol, called Preview. It's a 5-minute test. We don't need a blood draw and you don't need to fast. And tissue cholesterol is an independent risk factor for heart disease. Our second lead technology is the Scout. This is the world's first no blood draw, no fasting screening test for pre-diabetes and type 2. We have 38.7 million shares out in terms of our corporate structure. We just closed a financing for 1.3 million in December. And that's a 50,000-foot view of Miraculins.
All right, so we have the big deal in China. I just want to take you back now to the most recent news release, because you mentioned all in the news release, all your accomplishments, some of the highlights for 2014. I actually think that there was more in addition to that large deal.
There were. 2014 was the financial markets were difficult, so access to capital was tough. So we did have to focus our initiatives. 2 or 3 other accomplishments for us in the year. We interfaced with the US FDA. So the Scout is approved in Canada and it's cleared for sale in Europe. The discussions we had with the FDA in the US was to try to clarify what the best regulatory pathway is for the Scout. So having met with the FDA on a number of occasions, we plan to go back to them. The FDA has an informal process called a pre-submission review where you can file your plan with the FDA. After meeting with them, we're hopeful that we'll be able to have a Scout approved as a de novo classification in the US, and this would be very good news for Miraculins. An additional milestone was the transition of our manufacturing, which was in-house prior to a mid-sized device manufacturer in the U.S. This was a very big process. When we acquired the Scout, they had a facility in New Mexico, and we transitioned a significant amount of our inventory and all of our engineering and processes to this firm in Philadelphia called Avo Photonics. They're specialized in optical medical devices, and this is a major achievement for us last year.
Now, of course, just looking at the U.S. markets as well, the FDA process is quite onerous. Can you just kind of take us a little bit through where you're at right now?
Well, medical approval of devices is very different from therapeutics, but what the FDA will do is classify your device as 1, 2, or 3, and that has a lot to do with what your device does, how it functions. Is it X-ray based or CAT scan, or is it in vitro? We are looking for a Class 2 designation for the Scout. Keep in mind that we're not drawing blood, so we're using a light source to scan someone's skin for markers that are present in abundance when you become pre-diabetic or type 2. So it's non-invasive, it's painless, What's concerning to regulatory bodies are what is the claim we're making for the test, and what the strength of the Scout is in identifying the pre-diabetic patient. Over 80 million U.S. Citizens are pre-diabetic, according to the American Diabetes Association, and the vast majority don't know. And since the average individual in North America is going for a physical every 3 or 4 years, and you can have diabetes for 3 or 4 years, we've got to screen the mass population. And the Scout is a point-of-care, high-throughput, high-sensitivity test that we're anxious to get to the market because we want to help people and change their lives and get them healthy.
So, in addition to this global market, can you tell me what are the key markets that you'll be prioritizing?
So the 3 key markets for the Scout include the general practitioner family practice office. Millions of people going to their family doctor for a variety of reasons, not for a physical. Everybody that is not diabetic can get screened on the Scout. If they're elevated, the physician can have their blood requisition done and they can go and get the blood standard test. This is a slower market to break into because most major markets have socialized healthcare, and you need reimbursement really to get traction in that space, and it's a process we've begun. The 2 other markets that we're going to be focusing on in the first 2 and 3 quarters of this year is the retail pharmacy, food pharmacy market. We have done testing already with the Scout in retail pharmacies in Canada where we have approval, including food pharmacy stores. And having a diabetes screening station in a pharmacy or food store setting is really perfect because it's very related to lifestyle and food and diet and nutrition. And so we can capture people who are walking into these stores and get them screened. The type 2 diabetic patient represents $3,000 a year to a pharmacy in terms of their medication and their supplies. So these are individuals that the food or pharmacy want to identify and can market their products to. The 3rd market is workplace screening. We conducted a number of pilots last year with employers where we send nurses or dietitians in with the Scout and screen the staff on site. And we plan on doing a number of pilots with some large Canadian employers this year, and I think that that's a market that's going to respond quickly.
Well, that sounds like, I don't know, that plan makes sense to me. Thank you so much for joining us today, Chris.
Thank you, Tracy.